Ophtec.
The first step in any toric IOL implantation must be the proper preoperative orientation. For that purpose, we first like to mark at the ophthalmometer the horizontal axis, and then, helped by the topography and the information provided by the company, we will precisely orientate the IOL under the surgical microscope. Once we have it orientated, I change my position on the microscope accordingly in order to always work from the same position. First of all, we create two lateral paracenteses. Through one of them, we introduce either myocol or acetylcholine to diminish the pupil size. Through the other one, we used to inject a little bit of our standard viscoelastic. Then we create the one-plane 3.1, 3.2 millimeters posterior corneal incision, through which the IOL will be inserted with the help of the insertion spatula. We evaluate the proper position in the spatula of both haptics. In order to protect the entrance, we used to put some more viscoelastic on the frontal tip of the IOL, and then we sweetly introduce the lens through this incision. As you can see in this diagram, the lens is squeezed through the incision, and we like to do it in just one maneuver until the complete optic is inside the eye. Once the optic is inside the eye, we gently push the proximal haptic in order to have all the lens in the anterior chamber. Some more viscoelastic in the front surface of the IOL to protect the endothelium is introduced, and with the positioning spatula we take special care on the centration of the optic over the pupil and the orientation of the haptics on the desired axis. Then, with this bimanual technique and using the VacuFix system, we will introduce a small amount of iris folds inside the claw, as shown in the diagram. You can see the same maneuver under the surgical microscope. One of the main advantages in using this VacuFix system is that there is no small rotation once we introduce the iris fold inside the claw. This small rotation must be taken into account when we use the insertion needle instead of the VacuFix. This is another example where you will use the enclavation needle. As you can see in the diagram, we introduce gently, in the similar way, a couple of folds of iris inside the claw. But doing that maneuver, we should take into account that the iris we grasp is a little bit proximal to the final positioning of the IOL because of this about 5-degree rotation. So using the needle in toric implantations is a little more tricky than using the Vacufix. Once both iris are enclavated in the claws, we should check the correct centration and orientation of the IOL. Any deviation from our goal should be corrected in that moment. At the end, we will use our vitreoretinal forceps to create a small superior iridectomy, something extremely necessary. We will close the paracentesis with hydrodissection, and we indirectly check the final induced astigmatism.